Well, if you are retired or getting ready for retirement, there's a lot to consider when it comes to healthcare coverage. I want you to meet Bob Gunia. He is Senior Vice President, Public Affairs Group with Physicians Mutual Insurance, and he's going to tell us exactly what we need to know. He's going to break it all down.
Break it down.
Because it's so confusing and it is so intimidating.
Terry, you're right. And you know, the emotions that people, when they're approaching retirement, are similar to what we've experienced the last couple of years. It's the isolation, it's the frustration that comes with not having any previous experience in making a decision. And so when you retire, you don't have previous experience to rely upon. So
right.
it creates anxieties, and people avoid the situation, especially when it comes to their health coverage.
Right.
The good news, it doesn't have to be that way. With good education and a good overview of what your options are for your health coverage in retirement, it could be a good experience and dare I say, a joy-filled experience.
Well, I liked what you said to me just a second ago. You said, we retire once. You guys do this 1,000 times a day,
correct.
Right?
Yep.
So here's the thing that I like about what you told me is that you actually kind of guide us through. Because we have Medicare, we have those options, but we all know it's just not enough.
Correct. And so we bring certainty to an uncertain situation.
Right.
And when you retire, you typically lose three things. You lose your employer health coverage, if you're lucky to have that, as well as dental insurance to keep good oral health care going.
Absolutely.
And then group life insurance. And so when you think of your health coverage, your new best friend in retirement is Medicare. Mm-hmm. Probably one of your more complicated friends, but a good friend. It's a great program. But people need to realize that it doesn't cover everything. It only covers about 80% of your costs. You have to find a way, what about that gap? And so we sell Medicare supplement insurance as well as dental insurance to ensure some of those great coverage you had before retirement extend into your retirement years.
And here's what we all know is that we're all different. We're all heading into retirement at different levels. How do you navigate that for us? Because we're all unique and have different needs.
Absolutely. And so it is important to sit down with someone to go through your particular situation. And for us, it starts with education.
Okay.
And so we go through the ABCDs of Medicare.
And everybody knows what that is.
Well,
that's confusing right there.
So just briefly, Terry, just a quick synopsis of those four parts. Part A is your hospital coverage. So it typically, people enroll in it right when they turn 65. Mm-hmm. And they do that because there's no premium associated with it because you've already paid for it.
Right, it's quote unquote free.
Yeah, your pay stub right now has a Medicare tax.
Yes.
That's part A.
Right, okay.
Part B, there is a monthly premium that goes with it, about 25% of the cost. So people need to determine, when do I enroll in Part B? And that's after you lose your employer coverage. And that's particularly important for people that are working past the age of 65. Part C is Medicare Advantage, which is a completely outside of Medicare program. It's a privatization of Medicare, and that involves some networks, and so that's something to consider. And then Part D is drug coverage, your prescription drugs. And so A, B, C, D is the main pillars of the Medicare program.
All right, so actually that was quite helpful. A lot of people avoid it because it's confusing, even though you just simplified it, but you're gonna help us do that. One quick question, you talked about dental, you talked about group insurance. You also do something for our furry little friends?
Oh, yes.
Really?
You
have 30 seconds to tell me what you do.
Oh my gosh, 30 seconds for these wonderful pets, they're part of our family.
Yes, they are.
And so we have...
Especially into retirement.
Oh my gosh. We've listened to our customers and they say, hey, do you have options for pet insurance? And so coming soon over the next couple of months, Physicians Mutual will be offering pet insurance. So the entire household, dogs and cats, can be covered.
So from your teeth to your furry buddies, you've got us covered.
Yes, you'll all be in good shape to have a joy-filled retirement.
I knew he would make it simple. Thank you so much, Bob. All right, if you want to learn more about health insurance in retirement, all you have to do is visit this website. They're going to help you out, physiciansmutual.com.